pain disrupts the quality of life. Like when we are doing our regular routine work and when we don't have this pain, we just take it for granted, but one small thing which disrupts our routine, and when we have that pain, we start trying to remember all the good things we had when we didn't have this pain at all. So the problem I had was a hernia near my lower abdomen, and I found this out during an ultrasound, and I was referred to by a family friend, and I came here to get this checked and tested. I didn't have a thought of surgery, that I would need a surgery or anything, but it became all of a sudden that I had to get operated.
In a male or a female, it is inguinal hernia, which is the most common hernia. Whenever there is an increased intra-abdominal pressure, for example, when you are coughing, when you are sneezing, or when you are straining while passing stools or urine, that time you can see the swelling popping out near your groin area. And normally it goes back on its own. Sometimes what happens is the omentum or the fat layer of the abdomen, it comes and gets stuck in the hernia defect. Then it causes pain. Sometimes intestines, let it be a small intestine or a large intestine, it can also protrude into the defect and it may got stuck. If the intestines get stuck, that becomes a surgical emergency. So we have been doing hernia surgeries either by laparoscopic approach or by robotic approach. And robotic has got lot of advantages over the laparoscopic counterpart. What happens in robotic surgery is we make very, very tiny cuts over the abdomen. That is, it is just 8 mm cuts. And the robotic instruments on the port, what we place to accomplish this hernia surgery, won't damage the muscle. So that's the reason that the patient will have minimal pain. So he will start walking within 6 to 8 hours after surgery, and he is normally discharged the day after surgery.
The reason I was scared to get operated was because of lack of time, because I had my flight in less than 72 hours. So I was thinking, can I get operated and leave within 72 hours?
A robotic surgery, it gives nearly 10 times magnification, whereas the laparoscopic approach gives us 4 times magnification. So when the magnification increases, the precision in which the surgeon can operate also will increase.
Robotic surgery is a very fast and a very precise method. Idhiralli downtime is very less. The time it takes to do the operation and time it takes to recover. Thursday morning operation aitu, and today is Friday afternoon. I'm up sitting and walking. The pain is minimal, and I'm trying to fly to the US tonight.
With this technology, we can perform very complex cases with very good results for patients having gastrointestinal cancer or any cancers of the liver or the bile duct. Other benign conditions, for example, many people will suffer from reflux disease or a GERD. So such patients can be offered fundoplication surgery by robotic approach. Other simpler problems where robotic surgery has got a definite advantage of performing all the surgeries in the abdomen. So robotic surgery has definitely brought lot of advantages to the surgeons community and also to the patients. I am Dr. Ganesh Shenoy. I am the Director of Department of Minimal Access Surgery, GI Surgery, Bariatric and Robotic Surgery, working at Kauvery Hospitals, Electronic City, Bangalore. Kauvery Hospital, Electronic City is the only corporate hospital in the state which is accredited as Center of Excellence in Hernia Surgery by our parent body, the Hernia Society of India.
So I feel absolutely there is no need to fear about robotic, and yeah, it's not done by a robot, it's actually done by a professional who is controlling the robot. I feel, yeah, that's going to be the future of operations or surgery.